Well, welcome everybody. I'm Bill Moore, and I'm a photographer in Denver, Colorado, and I teach dental photography, both intraoral and what I call dental portraiture to dentists around the country. And actually, I've some around the world. It's been quite an interesting thing. And today, I'm very excited because I have Dr. Dawn Wehking here, who has actually done dental photography for a while and implemented it in her practice and is reaping some benefits from that. So I want to welcome you, Dawn. I asked her to send me a little bio, and it was kind of interesting. You really wanted to go into the restaurant business at first, is that correct?
I did. Yeah, I thought I would have a cool bar restaurant scene. But then I worked at one during college and I realized, maybe the late nights and that scene isn't for me. But, in a lot of ways, dentistry is the same for me, where, you get to see people on a consistent basis and you build a relationship with the community. And so all of the things that I wanted about owning a restaurant, now I get with dentistry, but then also the artistic side too.
Well, from the bit that I know of you, that all seems to make perfect sense because you're a very personable person. I imagine that your patients just have a great time when they come in to see you. And from some of the photos that you sent me, I think we're going to prove that.
Yeah, we have fun.
Yeah, well, that's a good thing, and I have to kind of toot your horn here because it seems like, and this is really, I think, very important, that you love to keep up on things. So you do a lot of continuing education. You said over 200 hours every year,
Uh-huh.
and
Yeah, I'm kind of a
and well, I love to learn, and so I think a lifelong learning kind of career is a good thing because it keeps you up to date on things and it keeps you ahead of the curve if you can be, as much as you
Yeah,
can be.
it keeps it fun and exciting.
Yeah, it does. And a couple of things here that I thought were very impressive. You were recently awarded a fellow status with the Academy of General Dentistry.
Oh, thanks. Actually, I'll get my mastership award this year. So
Very good. And you're teaching on behalf of the ADA, I guess, to dental schools across the country, and you're visiting faculty at Spear Education. So
yep,
those are good things.
thanks.
How long have you been doing this?
Almost 7 years I've been a
So
dentist.
that's a lot in 7 years. So congratulations.
Thanks so much.
So now that everyone knows that you're a superstar, I wanted to talk about your practice. You're located in Lafayette, Colorado, which is kind of a small town. Why don't you tell us about it?
It is a really small town, and when I was looking for an office, I sort of just thought that I would be in a traditional dental clinic setting. And so,
Mhm.
when you purchase a practice, it's kind of like buying a house. You call a broker, and they show you different practices, and you pick the one that you like the best. And I told the broker what I wanted, and he said, "You've got to see this little house. It's just perfect, and you have to meet Dr. Belford." And it just was the perfect fit. So I'm in this little house in a little small town, but it's growing quickly. Lafayette is really awesome, but I've just got 3 operatories, so we kind of see one patient at a time, and I just am so thankful to have kind of thrown away that clinic setting where you're just, rush and rush and rush and rush.
As far as the topic today, dental photography, what kind of made you decide that you were going to jump into that?
Well, as you said, I had been doing a lot of continuing education, and everyone was talking about photography, and you have to try to implement this in your new patient exam. And I had taken courses and learned about f-stop and shutter speed, and you even taught me some of that. But at the end of the day, I didn't know what camera to pick, how to set it up really, and what settings I actually needed for intraoral photography. And at the end of the day, I'm a dentist. I did not want to be a professional photographer. So what I was so thankful for you for was just making it easy. I've got 2 settings. One if I want to take a picture of teeth, and one if I want to take a picture of the face. And so it is just so easy. And I love it. We take 11 pictures on every one of our new patients. And it just helps it really helps them see what I see. So instead of holding up a mirror and having somebody try and look in the back of their mouth, a picture is really dramatic when you can make their teeth the size of their head.
Yeah, that does tend to have an impact. I've heard from
Yeah,
a lot of doctors that when you do that, patients say, please fix that. I don't want my mouth to look like that.
right.
So
Yeah.
I guess, in addition to hearing about this in courses, there was some sort of um, return on investment you were looking for based on, the stuff that you had to get. And I think one of the reasons that we were able to connect, as you said, was, I try to make this really easy. I kind of say,
Mm-hmm.
here are my choices for you. If you don't want to become a photographer, you need to have equipment that's going to make the process easy. So here are some suggestions and my recommendations. And I think you have a Nikon uh, camera system. I
Uh-huh.
recommend both Nikon and Canon, but to lay out a couple of $1,000s, which is really what it takes
Mm-hmm.
to get started. What was your business decision at that point?
I had a couple friends who said, honestly, you can't afford not to do this. And you still sort of think about it, this could cost between $2,000 and $3,000 to get things set up to a good starting place. And it's a lot of money. But honestly, I think you can't afford not to. And I almost, if I had to pick like my digital x-ray sensor or my
Mhm.
Nikon camera, I think I would pick the Nikon. Like I use it probably 10 times a day. It's just probably my greatest office. I love it.
Well, that's what I like to hear, actually, because
Yeah.
using it 10 times a day means that it has to be a simple process. It has to
Mhm.
be something that you can pick up, and after a little practice, because it does take a little bit of practice to get the hang of it. Using mirrors and getting the right angle and all that kind of stuff, and and then the money outlay. It's funny. I talk to a lot of dentists, obviously, and they're very, very frugal when it comes to picking out photography equipment. But if you go into their office,
Uh-huh.
they want to have every bell and whistle under the sun. I don't know if you're like that too, but when it
Mm-hmm.
comes to cameras, the decision seems to be a little tougher for them to make. And
Yeah.
I was interviewed by Dr. Howard Ferran, Dental Town. I don't know if you are
Uh-huh.
familiar with them, but
Yeah.
he was saying, it'll pay for itself in a procedure or two. Is that
Right.
is that kind of the way you looked at it?
Yeah. I mean, on one hand, I sort of thought, well, I'll drop 5 grand on a course without thinking too hard about it because you sort of think about the return on investment and how much you'll learn. So I thought sort of the same thing about the camera. But I think most dentists at this point have, the little intraoral camera in the hygiene room where you can take a picture of one tooth at a time. And that's
Hmm.
great if you show a patient a picture of one tooth that's cracked, they'll assume that the other teeth are perfect, right? So what I
Yes.
love about doing it this way is if you want patients to think about their whole mouth, then you have to show them a picture of their whole mouth. And so I like this where they'll be like, "Oh my God, what's going on there?" Or wait, why do I have that big black spot there? Or why is everything sort of generalized yellow? What's that about? So it gets them asking questions. And honestly, that's the best way to get treatment acceptance, I think, is to just have them start asking questions.
And is that what your the other doctors who got you involved in this were telling you, that once you did that, then the patients would start doing what you just described, and it would help with treatment acceptance?
Yeah, and that's a big part of the training at Spear is just learning how to, instead of, everyone always talks about selling treatment, and that's just, it's so disgusting, honestly, to like sell healthcare. In this way, we're letting the patient sort of be responsible for seeing their mouth on a big screen, and then they kind of take the leadership role. You just answer the questions and go from there.
Right. Well, that's important to someone like me because that's the way I like to work. I like the doctors to kind of give me the big picture and then say, if there's something that needs immediate attention, then I want to know that, of course. But then
Hmm.
I can start asking questions and kind of intelligently moving toward where I want to be and where I want to end
Right.
up and working with
Yep.
my doctor in that way. So
Yeah.
sounds like we'd be a good fit for
Yeah.
that.
So then
I'm
you're
afraid
in the
I'm afraid to
pharmacy.
open my mouth here because I
No.
don't want you to. We need to take care of that, Bill.
Come
Um,
a little closer.
Nah, no, I'm not going to do it. So, so you had this initial investment to make, and how long do you think it took you to, get a return on that with the camera equipment? Because that was the first step. You were just doing the intraoral part first, right?
Yeah, probably a month or two. At first, I had kind of a rocky start with it. So you get the camera, and I'm ready. Okay, so the first new patient comes in, and they sit down in the chair, and the assistant says, "Okay, we're going to take all these pictures," and they took all the pictures, and the patient was like, "Hey, whoa, 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 whoa! I'm not here for cosmetic stuff. I think this is very inappropriate. I just want my cleaning exam." And they didn't come back. That happened once, and then
Oh, wow.
and I thought, oh my god, this, they're training about taking all these pictures, but this doesn't work. And then what I realized is if everyone's mostly been treated the same at most dental offices, they come in for their cleaning and exam and X-rays, and if you do something different, now there's a trust issue, right? They're thinking, why is this lady trying to sell me cosmetic stuff, and all I wanted was a cleaning. So I learned pretty quickly when we sit down for that new patient appointment, I kind of tell them how it's going to go. We give them a tour of the office and we show them why we're different and all the training that we've done that's different. And then I let them know we're going to do this a little bit differently. We're going to take x-rays and do your exam like you're used to, but we're also going to get some photographs of your teeth, and that'll help you see what I see. And then year by year, we can monitor changes so much better with a photograph than we can with all of these measurements and x-rays that we're taking. So this is just an extra diagnostic tool. So that it took about a month or two to figure that out, but then immediately it'll pay for itself.
Well, that's great. The comment you said, I want you to see what I see. That's got to be really important. And I think the approach that you took was great because, we all learn from our missteps, I guess. And if someone walks out and says this isn't appropriate and never shows
Mhm.
up again, yeah, that would be a cause for concern. But
Right.
I think you did a great thing and just figured out a way to make it fit in with what you do and how you do it. And every practice is going to be a little bit different.
Right. Yeah.
So you kind of struggled, I guess, a little bit with the patient understanding what you were trying to accomplish. And it
Hmm.
sounds like you had a good way to get around that. And then it was the time before that, it was the financial piece of it, right? What do I buy? Can I afford to do this? What's the payback period? And it sounds like that worked out really well for you as well.
Right. Yep.
So, as far as getting up and running with it, I always suggest to my students that they practice on their staff, and I know that people go, no, 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 I don't want you doing that. But
Yeah.
staff acceptance is really important. I don't know, are you the only one in your practice that makes the images, or?
No, we've got most everybody's trained to do it, and that's super helpful for me. So I can just say, "Hey, will you go take a set of photos on this patient?" And I don't have to be the one doing it. But practicing on the staff is helpful because I think there's a lot of stress initially in holding that giant camera and having the patient hold the retractors, and now you're shoving this big mirror in their mouth, and you're worried that it's so uncomfortable, and you start to panic, and then you take a lousy picture, and somebody's doing that to you, you realize, it's really not that bad. You can just kind of take your time and relax. And still, it only takes 2 minutes start to finish, really, to take all those pictures. But I think it's important for the staff to know what it feels like on themselves, and then they learn so much in that process too, so they can take photos.
Yeah, that's a great point, because when you're comfortable and you know what the experience is,
Mhm.
then you can relax and do what you need to do, like you said. Now, um, I found that probably 80% of the practices I've dealt with, the doctor is not the only one who makes the images, and that is, I think, a big deal. So, how did you get your staff to buy in to the fact that, oh my goodness, look at this big thing you want me to hold in my hand and do what with,
Right.
and how did that all work for you?
Right, because there is that problem with the team too. They're used to doing exam x-rays, cleaning on the first visit, and now you want me to do more work? What's this about? But the first few patients, I did the photos, and then they can see how much easier that conversation goes. You show them the picture, and then the patient's like, "Oh, that makes sense. Okay." And I think that when I leave the room, the patients will always ask the team, "Do I need that? What's that? What did she mean by that?" And when they have the picture there to reference as well, that helps them have that conversation too. So the buy-in was super easy as soon as they saw that conversation.
That's good. And what I hope also makes it easier is the fact that, and for the to let the audience know, really the way I teach intraoral photography is that you said it there, you have two settings on your camera. There are a whole bunch of different things you need to set in the camera, but we save them to a position on the camera. So you turn a dial to load your intraoral settings, turn a dial to another setting to load your portrait settings. So the staff doesn't have to remember what the f-stop is, the ISO, all that stuff. We've had the camera remember all that for you. It needs to be set up, at the beginning, of course, but it makes the camera more of a tool than something that you have to, pick up, take a picture, and fiddle with constantly.
Mm-hmm.
Once you have enough practice, I hope you'd agree that it becomes more of an automatic process and very, very, very simple.
Super
Would you
simple.
agree with that?
Absolutely. The setting from 1 to 2 is just brainless. The biggest challenge we have is, did you put the camera card in the camera and did you turn it on? Like those are our biggest troubleshooting issues.
And are the batteries charged, right?
Right.
Yeah.
Yep. Exactly.
Well, that's why, it seems kind of silly. It might seem silly to some people, but, just thinking through all the little components you need, like extra batteries, so you can have one in the charger and one in the camera. So if a battery goes south, which it will while you're shooting,
Mm-hmm.
you can just pick up the charged one, replace it, and you're good to go. And the patient's like, oh, okay, no big deal. But if you're fumbling with things, you want the patient to be confident and comfortable with what's going on. And that gets to another point. You mentioned that when you're taking the photographs, maybe you could step through a little bit about the actual process, because I always teach, okay, you want to have the patient help you, because
Uh-huh.
you want to hold the camera with two hands. So you want to have the patient maybe hold the retractors, an assistant with a mirror, so you can really work on the angle and focusing in the right place. How does that work for you?
Most dentists will have their patient lay in the chair and then sort of like lean over them in the
Yeah.
chair. It's funny. I was at a course and I had this dude. He literally straddled me on the chair to take a picture right in front. But then I had this consultant come out and he taught me turn the patient kind of side saddle so their legs are sort of sitting off the side of the chair. That helps a lot, so you don't need to straddle them. And I just go one at a time. Okay, smile. Okay, I'm gonna give you these. Go ahead and hold these handles, and we'll do these. Turn this way. Turn this way. And then with the mirror, usually I'll hold the camera with one hand, and they'll hold the retractors. So I'm shooting with my right and then holding the mirror with my left hand.
Okay.
Yeah.
All right. Well, that is, whatever works is what you need.
Yeah. Yeah. You do need the
Ideally,
patient's
a third. Yeah, ideally another person would be handy for the mirrors, but you find what works, and the settings that we use make it so that you don't have to really worry about the camera shake so much and getting things out of focus, because we let the camera help us with all that stuff. So it makes the process a little bit easier. Um,
Right.
okay, so we've got the patients to buy in, we've got the staff to buy in, you've got your process figured out. Now, what's it doing for you? Talk a little bit about what you do with the images. I know that you've talked about treatment acceptance has increased,
Mm-hmm.
but you've mentioned a couple other things to me about communications with other doctors and labs. When you get into the dental portrait stuff, showing them online and things like that. So talk a little bit about what you're doing with your images and what it does for you.
Yeah, so just before we put in the photo studio, just the regular images were perfect for communicating with the lab and other dentists. And now that I'm doing more with Spear, that makes more sense to have images to show other dentists. But my initial setup had the one flash on top. So in order to get like a full face photo, I would bounce the light off the ceiling and take a portrait like that. And that looked pretty nice with a gray background. The lighting was pretty nice. But then I would go to these CEs and see these like beautiful portraits. And so I thought, wouldn't it be cool to be able to show off the after photos in that way? So I would almost consider this like a phase one photography and a phase two. So my phase one with you was the intraoral, and the phase two is what you're about to show is this photo studio.
Right.
That's
And
how I
so what I've done is I've developed some settings like you were talking about that you can dial into that spot on the camera and save for different options for doing what I call dental portraiture. And one of the options is to have the camera or speed light right on the camera as you were talking about. And here's a progression of images I made with that. So if you point the uh, the light off the ceiling as you were talking about, this is kind of the look you get. If you add a little white card to it that the flash has, it fills in a little bit around the eyes so your eyes don't look quite dead. And
mm-hmm.
then if you put a reflector on it, it ends up looking like this. So you can get pretty nice images
Mm-hmm.
for a low entry point. And then if you want to kind of improve the light, you can start adding things like umbrellas, which are called light modifiers. So here's a series of images in that respect until you get to number 6 here, where it says, okay, we've got light coming in from both sides, so we're lighting the face evenly, and it gives a really, really nice look. And then where you are is you have a whole studio set up in your office. Not everyone has this luxury because it does require a little bit of space, and like you said, you have to wheel things out and wheel them back. But again, there are some options that you can look at there if you have the right kind of setup in your office. But this puts background lights on the background, so you can make this what in photography terms is called a high key look, which is really a lot of fun. And I'll show some of the images that you've made using that. So if you look at those 3 options and what they actually cost entry point wise, it's really inexpensive from just shooting straight at or bouncing the light off the ceiling with the on-camera flash to a whole portrait studio. There's a little bit of investment, but to do that, you need some stuff, right? So,
Yeah.
and in the course that I teach, I give all the measurements. You place the lights here, with or without a background, the umbrellas here, the patient goes in this same spot. So the setup is defined and repeatable all the time. So that's kind of the way it works. Now, do you want to show some of the images that you've been
Sure.
taking?
So that first one was bouncing the one flash off the ceiling. As soon as you whip out the umbrellas and the flash in the background, and now it's kind of a production, and you say work it, I mean, they will work it for you. We've had a lot of fun with going from standing in front of a wall to that whole setup.
The image on the left here is what most people take. And as a matter of fact, they're usually using the intraoral flash on that. So it doesn't even look this good. So basically what happens is you end up on the left, typically, someone's using a ring flash or the dual point flash, and you end up with an outline, a shadow outline of your patient on the wall behind them. And on the right here, with your setup, you're putting light on the background. It's an experience for them rather than anything else. Like you're saying, work it, and they'll start doing stuff for you. So and the quality's much nicer. We should be looking at her mouth, right? The before and the after work. Huge difference. So you want that to come across. You don't want to tell them in the before picture, hey, look miserable, because in the after one I want you to look great, right? But you can tell it seems like she's more confident because of the work you've done for her, and that's exactly what I would hope you would impart through your photographs. Tell me about Daryl here.
Oh, Daryl is such a sweet guy. So that picture on the left, again, an example of our phase 1. And this is when we said, okay, smile. That's what we got from him. And he just didn't want to smile.
And then, this is a composite, of course. So you have some of your intraoral photographs to show the progression of the work and what actually happened there. So that's great. So there's a bit of a difference, eh?
Yep. And you can tell that first picture, like you said, you can see that ugly shadow around his head.
And just so the viewers know, another thing that, just a little tip, if you don't want to see this shadow, it's real hard to get rid of if you're using your intraoral lights on your DSLR. But if you bring the patient 4 or 5 feet away from the wall, like in a hallway or something, you can hopefully minimize that, hopefully get rid of it. But you're always going to see a little bit of that. But over here, that's a professional looking photo. And he looks like a happy guy.
Guy, yeah.
Yeah. And intraoral photograph. So you see the whitening of the tooth. I'm not going to tell you what you did because I really don't know, but but before and after, and what I would comment here on is it's very consistent. So your lighting is good. You're seeing all the surface detail, and I don't know if there are any comments you want to make about these images here.
The consistency is huge. When the lighting's different, it looks like, wait, the after picture looks yellower than the before picture. What happened?
Yeah, and that's all a matter of your settings. So I suggest everybody put everything in manual mode, because that's going to give you consistent results, and that's what Dawn, you're talking about, because the white balance needs to be the same. So the color, we got to remove all the color cast. So when the patient comes in for and you take the first shot, you'll get this, and nice use of a contraster, by the way. And then when you come in for the second shot, the color, the exposure, everything's going to be the same, so you can really see what a huge difference that is in that incisor. So bravo.
And that was actually just published in the Journal of Cosmetic Dentistry, that case right there.
Very, very good. Nice. Then is this part of the series of photos you take of every patient?
Yeah, this is just an example of, when you can show the patient their whole mouth, it just makes a huge difference.
Yeah, because normally we don't know that the yellowing in our teeth goes all the way to the back, because we don't look at that. We don't see all the little defects in different teeth. So that's a great way to show everything that's going on, and for the patient to see what you see. That's very good.
Yeah. Well, and you can even, when the file sizes are this big, you can zoom in on certain teeth, like this one, for example, and the guy said, "Is that pus coming out of there?" And you're like, mean, that's kind of an emotional response when you can show somebody what's going on in that way. What happens is I'm taking the photos and I'm saying, okay, smile, laugh, and I'm trying to make them laugh. But then I've got the assistants and the team back here just doing whatever they can to get what I really like is a true smile. We made her laugh. It was fun.
Yeah. Yeah. And, as a photographer, I'll tell you, it's so easy to tell a fake smile versus a real smile. And, getting real emotion is not easy to do. And you're doing a great job of it. So it's a matter of, it's obvious to me that these patients are very, very comfortable with you. And that's part of it. And then, having staff that are hams that's a good thing too.
Yeah, that's helpful.
Yeah. Huge difference in before and after, right? So old versus new. And then detail work. This is great detail in these teeth. Just excellent.
Thanks.
I'm so proud.
Oh, thanks. But you can't, I don't do that much cosmetic work, but you really can't show it off if you can't take a good picture like this, so it's just so nice to be able to show what we're doing.
So you were working it too, is that it?
Yep, that's it. And so what's great is I can hand the camera to an assistant or a hygienist and say, hey, I need a headshot for this thing. Can you take my picture really fast? And in 10 minutes, we've got a new photo instead of before I would call a photographer and we would have to set up a photo shoot. So that's super easy.
Yeah. So that brings up a question in my mind. You're talking about, the expense for this because, I was showing that you can set up a studio now for about, I think it was $1,200 or something like that for what you did, which is, the high end of it. But how much would you have paid a photographer to come in and do this?
Probably
That's
$400 per time. Per session is, I think, typical, right?
Yeah, I mean that easily. All right. And, more documentation. I mean, this is just excellent as far as I can tell. And I'll continue on unless you have a comment.
Cute.
Nice young man.
Yeah.
And, oh, how cute. And, traffic investigate. Well, did he come to arrest you and you just took his picture?
While you're here.
Yeah. Do you mind? Yeah. Stand over here. And here's kind of this is when we were setting you up.
Uh-huh. So we just have that little corner in the office that's, I have that luxury, like you said, of having a little extra space over there, but we just wheel those flashes back against the wall when we're not using them. And it's a screenshot of the website. And then, so that's just my page. And then the next one, we did this with the staff too, so that, you can see a little bit more of everyone's personality when you see how they ham it up. And to me, I feel like the patients feel like they know us by the time they're in the chair. They'll say, we had a guy the other day, he goes, I really love your website, except for that picture of you like this. And it's a terrible picture, but it's, it shows this side of us that you wouldn't have gotten from a photographer that came into the office to take our pictures.
Right. No, and it's a shame that none of you have fun while you're at work.
Right. Yeah, we hate it.
Yeah, it's terrible thing. But anyway, I think it's good to show different ways that you're using your images. I think that's a great thing. You're getting professional quality images with just by setting people on a stool and turning on lights and putting a little box on their eye and taking a picture. So that's a great thing. That's a really good thing, and I'm so happy that it's working out for you. Are there any words of wisdom you'd like to impart to people that are thinking about doing this or on the fence or anything like that?
Well, first of all, I thank you because I think I wouldn't have had the guts to really do it if it wasn't easy. There's too many moving pieces, it seems like, to really make this a part of everyday practice. But so you made that really easy. And I would just tell other dentists that there's no way you can afford not to at least do what I call phase one with the camera and the flash and taking intraoral photos. The photo studio to me is just sort of an artistic side thing, but at least the phase one, I think that every dentist should have a good camera with a good flash.
Yeah, well, I would agree. That's why I'm here, and that's what I do what I do. And
And
so,
also, I'm sorry to
yes.
interrupt. When I was looking, the way that I found you is I decided I needed to learn more about this if I was going to do it. And so searching for dental photography courses, the one that I had seen before I found you was, I think, $3,500, and I would have had to fly out of state to go do it. And that didn't help as much as it cost to have you help me out. I mean, you're really amazing, really super amazing.
Well, I really appreciate that, and the kind words, and I've thought long and hard about how to do this because I thought to myself, well, if I'm going to get involved in this, first of all, I love working with dentists. They're all so far have all been great people, and I love to teach and I love photography, so it's been a really good fit for me. And I sat down and I said, well, if I was a doctor, there's no way in what that I would do this if I had to become a photographer to do
Right.
it. And so, I wanted to say, okay, well, let's figure out how to set up the camera so it's going to act pretty much like a point and shoot, but you're going to get much better quality images, and I think you're going to go for your AACD accreditation at some point.
Uh-huh.
So you can't do this with some of the cameras that the doctors are using, and there's a big push actually out of people coming out of dental school. They're saying, well, why can't I use my iPhone for this? And you just cringed. Maybe you have a thought or two on that. And so it's not
Well,
coming from me. What are your thoughts on that?
I just think, how would you feel if you went to your doctor and I sort of feel like a mouth can be as vulnerable for a patient as like going for your annual checkup. And if you're going to be taking pictures of people, it needs to look super professional. And you can't, an iPhone is surely probably capable of taking a nice picture, but maybe not the most professional.
Still, you got to have the right tool for the job. And at this point in time, a DSLR is it.
Yeah.
Especially if you're going to do accreditation, especially if you're interacting with your lab and you need accurate color and a lot of great detail and all that kind of stuff. Why don't you talk about that? I think you do a lot of interaction with the lab here in town. Is that true?
Yeah, no, what's fun is our first, one of our patients went for the custom shade, and I met them there at the lab, and they had a setup that looked very familiar. And I said, did Bill Moore come here? She goes, yeah, I love Bill. He did all the setup for my camera. And so it turned out we had the exact same things, which really made communication super easy, that our cameras were set the same way. But, when the lab can blow up your picture this big, that helps with their job too.
No, it really does, and hopefully it cuts down on rework because you don't want to send a
Absolutely.
patient in and have a crown or something, a shade or so off. That's just not good.
Right. Yep. Yeah.
All right. Well, this has been a wonderful chat. It's always great to touch base with you. Any parting thoughts to doctors out there? Or should they just look for you on the circuit since you're out speaking and teaching?
Call Bill Moore. He'll change your practice. That's That's all I have to say, really.
Uh,
Thank you so much for really, you changed my practice. Thank you.
well, you're very, very welcome. It's been a pleasure speaking with you, and
Thank you.
I hope that our paths will cross again sometime. It's always good
Thanks so
to see you.
much. You too. Thanks, Bill.
Okay, take care.
You too. Bye.